Good evening, and welcome back to Rural Health Matters. I'm Dr. Jeff Gold, and thank you so much for joining us tonight on this very, very special day. Tonight, we're going to discuss a critical topic: falls. Falls are the leading cause of injury for older adults, and we need to understand what causes them, and most importantly, what we can do to prevent them. Later in this show, we're going to be joined by Dr. Dawn Venema. Dr. Venema is the Associate Professor of Physical Therapy at the University of Nebraska Medical Center, College of Allied Health Professions. She's going to join us tonight to share her insights and her practical advice for staying steady on your feet and not ending up with a bad fall and an injury. But before we talk about falls and safety and prevention, let's review this week's numbers and go right to the data and to the graphic charts. As always, we'd start off looking at where we are with COVID. And the news this week is that we're pretty stable from where we were the last several weeks. Test positivity is slightly lower than it was 2 weeks ago at about 6.9%. Emergency department visits unchanged, 1.3%. Severity indicators, which of course include hospitalizations, slightly upticked again at about 2.5 per 100,000 population. And then the death rate is at 1.5, which is roughly what it was last week, but about 0.5%, 0.5% higher than it was 2 weeks ago when we spoke on this broadcast. There's been no significant change in the variant type. We're still dealing predominantly with the XEC subtype of the Omicron variant. This does appear to be the dominant type across the country, and to a very large extent where we have data around the world, in the Far East, in Western Europe, Eastern Europe, etc. Does not appear to be any more virulent, cause more severe illness, hospitalization, or death, at least not significantly, but it certainly outcompetes all of the other variants that we've had since the very beginning of the COVID pandemic back in 2020. Hard to believe that it was almost exactly this time of year that the very first cases of COVID were being reported, many of them coming from reports in Wuhan City. And again, I remember all too well that some of the very first cases were about to be reported here in the United States, initially on the West Coast. And now, of course, we've had well over 1 million deaths here in our country and countless impact, to the point that COVID has unfortunately become and remains a household word, and probably will so for a long time. If we look at the case fatality rates, you can see compared to where we were 2 years ago, 3 years ago, almost 4 years ago, well down. But we've been in this plateau phase now for about 4 weeks, where although we're a lot lower than we were a year ago, which is what this dotted red line shows, the last 4 or 5 weeks have been hovering about 500 COVID-related confirmed deaths per week. And again, those are 500 individuals that won't be with us over President's Day weekend, at spring break, at 4th of July, when we gather with our families and our loved ones. And so anything that we can do to prevent and to successfully treat COVID is certainly in our very, very best interest. It is kind of fascinating to me that we haven't really seen the death rates fall any further. Perhaps the explanation lies here in the wastewater numbers. So this takes us back to this exact time of the year a year ago. And as you can see, the numbers over recent weeks and months went way down as we approach Thanksgiving weekend. And after Thanksgiving weekend, they continue to go up not only in the average national level, but in the Midwest and the Deep South and the Far West, and even now in the Northeast, which had been hovering at a fairly low level. If we look at the last 45 days of wastewater numbers, you can see unquestionably that the Midwest, our part of the country, has gone from low to moderate, from moderate to high, and high to very high. And now what was the lowest for a long period of time, the Northeast and the joining Mid-Atlantic part of the country, has rapidly, over the last month, gone from minimal to low and then spiked up in a fairly rapid uptick that it is not quite as high as the Midwest, but it's beyond moderate and now high. And again, whether this relates to colder weather, indoor events, more spread of this variant of the virus, very difficult to tell. Whether it relates to vaccine patterns or access to antiviral drugs such as Paxlovid, again, very hard to tell. But the wastewater numbers are still extremely good predictors of case rates, hospitalizations, and case fatality rates. So something for us to stay very focused on. Shifting gears, let's talk a bit about an update on avian influenza. As I promised, as long as this remained a challenge in the country, I would provide this update, particularly for our poultry producers and our dairy producers. Up to 134 million, almost 135 million poultry have been affected in the United States. There were several more outbreaks across the country in multiple different commercial sites. We're up to 927 confirmed dairy herds. Now, this is not confirmed dairy cattle. These are actual herds of dairy cattle with one or, and frequently more, individual cattle infected. And of course, this is usually identified through decreased milk production, typically starting off with one quadrant and then escalating rapidly as the dairy cattle become affected with high-path avian flu. Still, 16 states are involved across the country. When we look at the most recent outbreaks of dairy cattle, what you can see is they're all in California. They're all in the milking dairy cattle, and they continue to be densely populated in Central Valley and other parts of the state of California. Now, it is granted, of course, that they're doing a lot of testing, but there's also no question that they've got a lot of sick cattle, and indeed there have been several that have been culled as a result of the high-path flu. When we look at human cases, again, we're up one more time this week, 67 confirmed cases, 38 in California, all but 2 associated with milking dairy cattle. Colorado has got 10 confirmed human cases, 9 due to poultry and culling operations, 1 due to dairy cattle. And another one of the largest states is the state of Washington. Again, 11 out of 11 are due to poultry farms and culling operations on those poultry farms. So again, we will continue to keep you up to date on the high-path avian flu. So a week or so ago, 2 weeks ago, I guess it was, when we had Dr. Paul Friedrichs on the broadcast with us from the Center for Preparedness and Response in the White House, we talked about the viral outbreak that was going on in the Far East, and particularly in China. And it turns out the source of this is a viral infection known as metapneumovirus. One word, metapneumovirus. Now, so I thought I would take just a few minutes and share with you what metapneumovirus is, what we know about it, what we don't know about it, because we have had isolated cases pop up in the United States. It is not a new disease at all, but it is spreading rather rapidly in the Far East and potentially a source of both mild and severe infection. So first of all, metapneumovirus, human metapneumovirus, or HMPV, is a respiratory viral infection. It spreads from person to person or on surfaces. Symptoms commonly include cough, fever, nasal congestion, and shortness of breath. And it can be tested for. However, there is currently no treatment other than systemic treatment for symptoms, meaning decongestants, antipyretics for fever, and other such agents. Prevention measures typically include good hand washing, which is good to prevent any infection, cleaning surfaces, and of course, as we've talked about more times than I will ever remember, staying home when you are sick. So just to reiterate, the symptoms of human metapneumovirus infection are commonly associated with cough, fever, nasal congestion, and shortness of breath. It may progress to bronchitis or pneumonia, which is true of almost all respiratory viral infections. And it's similar to other respiratory viral infections, such as RSV, that can cause both upper and lower respiratory infections. The estimated incubation period after exposure is short. It's 3 to 6 days. And the median duration of the illness can vary depending upon severity, but it's similar to other respiratory infections caused by the virus. Normally it gets worse over the first 3 to 4 days or 48 hours, and then it progressively and slowly gets better, whether you treat it or you don't treat it, as there is no specific treatment for it. However, if pneumonia does occur or severe bronchitis, that certainly prompts emergency room visits, sometimes even prompts hospitalization, as we're seeing in other parts of the world. Now, it is spread mostly from person to person. Secretions from coughing and sneezing, close personal contact, such as touching or shaking hands, but also from touching objects or surfaces that the viruses have been on, and then touching your mouth, your nose, your eyes, etc. Now, we know that HMPV in the United States circulates in distinct annual seasons, and that usually begins in winter, and it lasts through the middle to the end of spring. So it shouldn't be a surprise to us that we're seeing these cases both here in the U.S. start to rise and across the world. What is changing, though, is the massive number of cases of this that we're seeing. And of course, when you have a lot of spread of any viral disease, you start to run the risk of significant mutation, to increase severity, or to increase transmission. It is important to remember that most of these infections are truly mild, and that in higher income countries, the virus is rarely fatal. But in developing countries or lower income countries with weak health systems and poor surveillance, deaths are far more common. And of course, infants, older adults, individuals who are immunocompromised are among the very highest risk. Patients that have pre-existing lung conditions such as asthma, COPD, or chronic obstructive pulmonary disease, or emphysema, are also at higher risk for severe outcomes by HMPV. So we do get asked all the time, is there a test, is there a vaccine, or is there a treatment? So as we said a few minutes ago, there is a test, so particularly for individuals that are concerned, your local healthcare professionals, emergency room, quick sick visits, or others can take a nasal swab and get you an answer as to whether you've got HMPV, which is not a bad thing to do. There is no vaccine for it, and certainly there is no specific treatment. There is research that is actively underway to find a vaccine to protect against both RSV and HMPV, as they are very similar. It would make a lot of sense to put them both into one shot and get it one and done. And as I said, there is no specific antiviral treatment for HMPV. There is a very good RSV vaccine. Treatment of both of these focuses on management of symptoms. So in summary, on this special day, what do we need to know in rural America? What's new? First, COVID wastewater levels, cases, and hospitalizations are still presenting in rural and urban communities. Unfortunately, as has been the case for the last several weeks, our wastewater levels continue to rise in different parts of the country. We've noted that the Northeast and the Mid-Atlantic has now taken a significant uptick, and that the CDC, the Centers for Disease Control and Prevention, continue to recommend a second dose or a third dose of COVID vaccine 6 months after the last dose, particularly in older individuals, and of course that means over 65, those that have high-risk medical conditions, immunocompromised, being treated for cancer, etc. You know who you are by this point, and I'm sure, and I certainly hope, that you're having a healthy conversation with your healthcare professionals. As it relates to high-path avian flu, the CDC updates continue to consider high-path flu low risk to humans. As I said earlier, there have been 67 confirmed cases, probably a lot more that have been written off to a common cold or even a mild allergy symptom. Although, in spite of that, the spread to poultry and dairy cattle continues to increase rapidly. There's a lot of work, of course, being done on both veterinary and human vaccines for high-path avian flu. And we learned, last week from Dr. Morrison and 2 weeks ago from Dr. Friedrichs, that our federal departments and agencies are very concerned about this, not because of what's been happening to humans across the country and around the world, but because of the potential for mutation and much more severe or transmissible illness. Then we talked a little bit about human metapneumovirus, first cousin for respiratory syncytial virus, or RSV, that is rapidly spreading in the Far East, with cases being identified in Europe now and, of course, in North America. As we said, there is a good diagnostic test for human metapneumovirus, but there is currently no vaccine or no treatment. And finally, I just want to remind you that if you missed any part of our updates tonight or any of our previous shows, all you need to do is scan this QR code, and it'll take you right to our YouTube site, where at absolutely no cost to you, you can have access to the totality of all of our broadcasts going back now well over 8.5 years. So we are about to take a quick break, and when we come back, Dr. Venema will be joining our conversation. Our phone lines are open. We look forward to hearing from you, and we very much appreciate your joining us tonight. We'll see you in just a couple minutes.
Hi, I'm Caleb, and this is my story. I was born with osteogenesis imperfecta, or brittle bone disease. I have broken my bones almost 200 times, and I have had 11 surgeries. But I didn't let that stop me. I love to bike ride, climb, race, and I'm learning how to stand and walk. Well, I can only do all of this because of generous people like you and Shriners Hospitals for Children.
Because of people like you, Shriners Hospitals for Children has helped more than 1.3 million kids just like me, regardless of their family's ability to pay.
Shriners Hospitals for Children is only able to provide this world-class, life-changing medical care because of the generous gifts of people just like you.
Because of you, I can ride my bike. I can play basketball.
Because of people like you, I can run.
I can smile.
Will you send your love to the rescue today?
When you go to loveshriners.org right now and give just 63 cents a day, you're helping kids just like me.
Like me. Like me.
When you give today, we'll send you this adorable Love to the Rescue blanket as a thank you, and a reminder of the love you gave to a kid just like me.
Your gift, no matter how small, can help a child today.
This is your moment to make a difference.
When you pick up your phone, I know you have it right there, and call to give. You're helping kids like me. Thank you.
Thank you.
Gracias.
Thank you.
Please call or go online now. If operators are busy, please call again or give right away at loveshriners.org.
Your gift makes a difference. Thank you for giving.
Welcome back to Rural Health Matters. Thanks again for being with us tonight. And now we have an opportunity to welcome our very special guest, Dr. Dawn Venema. Dr. Venema is an associate professor of physical therapy here at the University of Nebraska Medical Center College of Allied Health Professions. Her clinical and research specialty is in geriatrics, and specifically improving mobility and reducing fall risk for older adults, something we are all interested in. For more than a decade, she's been involved in research and quality improvement initiatives for fall risk reduction. And so tonight, we'll have an opportunity to talk with her about falls and how we can prevent them. Dr. Venema, thanks so much for joining us tonight. It's great to have you with us and to address our coast-to-coast audience. And our audience is always interested, before we talk about your specialty, about how you got interested in becoming a physical therapist and how that journey got you interested in geriatrics and how geriatrics got you into fall prevention. You know, it must have been an interesting series of events. Did you have a role model, a mentor? Was there a life-changing experience? Or what actually was the pathway?
Well, thank you, Dr. Gold, for having me on this evening. As growing up, I was always interested in science. I really enjoyed my biology classes and anatomy and physiology. And so that kind of naturally lends you to interest in a healthcare profession. I narrowed it down because I saw some friends and family members who received care from physical therapists. And so that's kind of what first interested me in it. And then I had some great local physical therapists in my surrounding rural communities that I had an opportunity to shadow, and that kind of sealed it. So I went on to the University of Nebraska at Kearney for my undergraduate time and did my prerequisites there, and then was fortunate enough to be accepted into the UNMC physical therapy program. And from there, I went into clinical practice for a few years and then decided to come back for a PhD. And here I am. I'm now on faculty, and I've been here for nearly 17 years.
Wow, hard to believe how time flies, and we've had the opportunity to work together now for well over a decade. Amazing. Now, you know, I think it's worth emphasizing with our audience that you're a rural farm kid, right? You grew up in a small town, I believe Clarkson, Nebraska. Is that right?
Yes, that is correct. Clarkson is a small farming community northwest of Fremont. It's about 600 people these days. I did grow up on a farm, and mom and dad are still living on the farm. So I'm really happy about that, and really proud to come from Clarkson, Nebraska. I'm not only a farm kid, but I actually went to a one-room country school from kindergarten through 8th grade. And then, went to a small high school, graduated with only 13 people. So I feel really fortunate to have come from a strong rural community in Nebraska.
Well, it creates tremendous relevance for our audience to talk about your rural background and, what you do today. So let's shift gears and let's talk about the subject at hand and falls. For those of us in the health professions, we are so concerned about falls, particularly in the older population. But maybe you can set the stage for our audience just a little bit about what the impact of those falls are and why we need to be so concerned in older patients and even in younger patients about falls.
So earlier you asked me about my interest in geriatrics, and part of what drew me to geriatrics is the ability to really impact people's quality of life. And so it's very humbling to be able to help somebody do something as seemingly simple as staying in their own home, walking up and down a flight of stairs, taking themselves to the bathroom independently. Those are all things that many of us just simply take for granted. But as we age, those tasks might become harder and harder. And so being able to impact people's quality of life and even their dignity and allow them to remain independently in their home is something that really drew me to geriatric practice. And falls are a huge problem in older adults. There's different statistics out there saying that about 1/4 to 1/3 of older adults experience a fall every year, and those falls can be fairly benign, maybe just a little bit of embarrassment. Maybe you get a little bruising and are stiff and sore for a few days, but it can also be very, very devastating with significant injury, such as bone fractures, concussion, brain bleeds, and lead to hospitalization, and then lead people to maybe not be able to live in the same setting that they were living in before. So I view, my interest in falls really focuses on, again, allowing people to be as independent as possible for as long as possible and have the highest possible quality of life.
So we're going to stay on this subject, but I just want to remind our audience that our phone lines are open, and we look forward to hearing from you if you have a question for Dr. Venema or for myself, anything we've talked about earlier or on any subject. We very much look forward to answering your questions tonight. So let's stay on this subject of falls, and I'm sure, prevention is the name of the game, and, all of us are going to age. That's the good news, because the alternatives to aging, as they say in the trade, are far less pleasant, right? But what should we be thinking about in terms of our daily activity that, before we even become really at risk in the geriatric age group, things we might do to sort of set the stage so that we can prevent the likelihood of a serious fall?
Well, as a physical therapist, I would be remiss to not mention exercise as a primary form of prevention for falls. And exercise is so important for many reasons, not just falls, but for the prevention of many chronic diseases like heart disease and diabetes. And a lot of those chronic diseases can lead to fall risks in and of themselves. And so if I were to suggest anything to anyone today, would be, even going through middle age. I mean, I'm in my late 40s myself, and so exercise is important to really set the stage for healthy aging and to start that as early as possible in life. And again, exercise, if there's anything that's kind of a magic bullet or a magic pill that we could take, it's having high levels of physical activity and exercise. Unfortunately, it's not as easy as just swallowing a pill. It takes effort, and I admit, even sometimes myself, I don't follow my own advice for that, but that's the number one recommendation I would have for people.
Are there specific types of exercise? I know a lot of physical therapists that I've known have talked about exercises that, maintain balance and ways of continuing to enhance your balance.
Yes, so probably the most important forms of exercise when it comes to fall risk are strength, flexibility, and balance exercises. Aerobic fitness and endurance is certainly important as well, but maybe a little bit less so in this case. But having good leg strength is very important, and then flexibility at like your ankle joints, that's a key joint for maintaining one's balance. And then when it comes to balance exercise, it is a bit of a fine line, because in order to maintain our ability to balance, we need to engage in balance exercises that are challenging to our balance, that almost puts us in situations where we might start to feel a little unsteady and then have to practice catching ourselves or correcting our balance. And so when you have someone who already is at fall risk, that might be a little dicey to do on your own. And so those kinds of patients would be very appropriate to see a physical therapist for a rehabilitation program where the intensity and difficulty level of that program can really be tailored to that individual's current level of ability.
I think that's a really, really important point worth emphasizing, that at a different stage of life, depending upon comorbidities, flexibility, what your previous exercise regimens may have been, everybody's different. And their starting point is different in terms of doing these exercises, whether they're strength or balance or stretching or whatever. And then the destination, how far you need to go, are probably different. And that's a really good reason to get professional help and not just, read a book or go to a website or ask social media, how do I improve my balance? Because what might work for a 40-year-old may not work for an 80-year-old.
That is absolutely correct, Dr. Gold. And I have to plug our profession of physical therapy. And so physical therapists are highly educated healthcare professionals. People graduating these days are graduating with a doctor of physical therapy. That means they've had 4 years of an undergraduate degree and 3 years of a physical therapy program. And so they're very well trained in different diseases and how those diseases impact your ability to move, and then interventions that are appropriate for people with different chronic conditions. So that exercise is important, but it also needs to be safe and kind of dialed to the appropriate level for any given individual. And even then, it's like even somebody with the same diagnosis or is the same age, everyone is different. And so that exercise program really needs to be individualized so that it is at an appropriate intensity to actually make a difference, but that it's also not potentially putting that risk, putting that patient at risk for something harmful as well. So if in doubt, get an individualized exercise program from a physical therapist. That would be one of my pieces of advice as well.
Well, that sounds like a very, very good piece of advice. So I'd like to spend a few minutes and talk about some of the risk factors that have been identified. Let's start to talk about what is not terribly uncommon, unfortunately, in people that have diabetes for a long time, and that is they have decreased sensation in their feet, whether they have numbness or tingling, and that certainly has been identified as a significant fall risk. And maybe you could talk a little bit about that and what, if anything, can be done to enhance balance and strength, even if people have some diabetic complications in their feet.
Yes, so if they've already had some loss of sensation in their feet, probably one of the best things they could do is some strategies to potentially compensate for that loss of sensation. And so sensation in our feet and feelings in our joints is certainly important for balance, but we also use our vision for balance. We also use our inner ear system for our balance. And so all three of those systems have to work together in order to kind of give the body a complete picture. Now, when you have a diagnosis that causes a decline in one of those senses, then you need to do some things to really emphasize the use of the other senses instead. So some simple things like making sure that you've got good lighting, turning on the lights when you're getting up to go to the bathroom at night. That's going to go a long way to compensating for that loss of sensation in the feet. Using assisted devices for walking, such as a cane or a walker, gives you an extra point of contact with the ground as well. And so that can also help those individuals a great deal with their balance, even in spite of having that decreased sensation due to the diabetes.
Yeah, so another risk factor that is commonly associated is individuals that have lost some visual acuity, and whether it's due to cataract disease or retinal disease, or frankly, just forgetting where you left your glasses at night. What are your thoughts about that? Particularly, obviously trying to remember where you left your glasses at night, that's a whole other issue. But what about those that are not so simply addressed? Do you have some recommendations for those? Because again, as you just said, your visual acuity has a lot to do with the sensation in your feet and what your balance centers in your labyrinthine centers in your ears and balance centers can do.
Yeah, so in this case, if you have visual problems, making sure you're going to see an optometrist or an ophthalmologist on a regular basis to try to manage those issues as much as possible and maximize what vision you have. That would be one of the best things that you could do in that case. And again, maximizing lighting, because if you already have some visual impairment and then you don't give yourself the benefit of good environmental lighting, you're going to be putting yourself at a disadvantage. So what can you do to maximize the vision that you do have in that case would be a strategy.
And then lastly, although I'm sure there's a long list of these, I'd like to talk a little bit about cardiovascular disease and heart disease, as it may reflect both people's inability to maintain their blood pressure when they stand, sometimes known as orthostatic hypotension or low blood pressure. And there are a lot of medications also that treat heart disease by allowing your heart to become more efficient, but that sometimes can prevent you from elevating and maintaining your blood pressure when you stand. And so do you have some advice for those? Because, I'm sure all of us, one time or another, if you're a bit dehydrated or, lacking sleep, you stand up quickly and you just have that momentary feeling of dizziness.
So one of the first things somebody like that should do is to work with their healthcare provider to make sure that the dosage of their medication is appropriate. And so, yes, we need to control people's blood pressure. But again, as you said, the risk is that sometimes the side effect, especially if one changes position too fast or is temporarily a bit dehydrated, could be a significant loss or drop in that blood pressure that makes you feel unsteady momentarily when you change position. Okay, so that would be the first piece of advice that I have, is to make sure that you're on appropriate dosages of those medications, or see if there's maybe a different drug with a lower risk profile that would achieve the same thing for your cardiovascular health. Beyond that, some simple strategies that you can do are to simply pause after a position's change. So, like going from a laying down position into sitting, sit there for a beat or two before you then get up and walk across the room or go to the bathroom or wherever you might be headed, is to pause for a moment between that laying down to sitting up and then sitting to standing as well. Just gives your body a chance to acclimate to the change in gravity and change in position. Making sure you're adequately hydrated would also be important as well. And then sometimes some very simple exercises like, kicking your legs up and down or pumping your ankles up and down, again, kind of before you change positions and move on into a different movement pattern, would also be a simple strategy that could be used.
Well, thank you for that. We're going to take a quick break, but I just want to remind our audience that our phone lines are open. I believe we have several callers that we'll get to right after the break. Thank you so much for being with us, and we'll see you back in just a couple minutes.
At Grainger, we know dealing with the unexpected is part of your job description, and we're here to help with professional-grade supplies plus same-day pickup and next-day delivery on most orders. Call, click Grainger.com, or just stop by. Grainger, for the ones who get it done.
The U.S. withdraws tariffs for now on Mexico, but what about Canada? A look at the impact those tariffs could have on producers, plus a final ride for a man who helped keep farmers going in the fields. 8:30 Eastern on RFD.
We're in Prescott, Arizona with Sarah Keycaffer at the K4 Ranch. It's 3 o'clock in the morning.
So how are you feeling right now?
I'm not bad right now until the coffee wears off.
Yeah. Sarah splits her time between ranching and barrel racing.
I am a very competitive person.
All the ranches and all the work that you guys do, how do you find the balance to still barrel race and as competitively as you have?
It's hard.
On Rancher, Tuesday at 9 p.m. Eastern on RFD TV.
I'm Mike Russell. Next time on Farm Week, Part 2 of Balancing Act, a compelling story of possibility in the Mississippi Delta. We'll conclude our encore report and learn how purposeful flooding is coordinated and how the bird habitat is analyzed afterward. For all the benefits of the project, there's a cost, and there's the inevitable rush to analyze the pros and cons during a race against time before planting begins. The conclusion of Balancing Act next time on Farm Week.
Do you feel overwhelmed by the constantly changing real estate market? You're definitely not alone. So many of our clients feel the same. That's why who you work with matters. I work with HomeLight to get the best deals for my clients. Whether you're looking to sell for the right price or hunting for that dream home, let's make your real estate experience smooth and rewarding. Start your journey at HomeLight.com today.
Welcome back to Rural Health Matters. Thanks so much for being with us tonight. Joining us once again is our special guest, Dr. Dawn Venema, and our subject, of course, is preventing serious falls. Why don't we take our first caller, who's Samantha from Tennessee. Samantha, thank you so much for taking the time to join us tonight, and what's your question or comment?
I've noticed my mother is starting to shuffle her feet a lot when she walks. Should I start preparing her house to help prevent her from falling? Thank you.
Well, that is a really good question, Samantha. And just to restate it for our audience, as the way I heard it, is that your loved one is starting to shuffle, and you're concerned whether that's going to lead to a serious fall or injury. And of course, part of the question is why is she shuffling? But let's ask Dr. Venema what your recommendation would be if it was a loved one or a patient of yours.
So if it was a loved one or a patient of mine, I think the first question is why is that individual starting to shuffle their feet? And so, it's potentially suggestive of something neurological going on. Parkinson's disease is a neurological disease that is commonly associated with a shuffling gait pattern. So I would want to have that person go see their physician and possibly a neurologist to rule anything like that out. In the absence of that, as a physical therapist, I would want to do an assessment of the flexibility of the joints in their legs and the strength of the joints in their legs to see if there's any impairments there that we could be addressing with an exercise program.
Super. So let's, for argument's sake, say that the person does see a neurologist. They probably get a brain scan of one type or another, and they do have early Parkinson's, which unfortunately is not uncommon in our society. We've talked a lot about it on this broadcast with some special neurologists that have unique practices and done research in the area of Parkinson's disease. Are there special advice that you give patients with Parkinson's in terms of protecting them from falls? Because certainly their risk must be, I would imagine, a lot higher than the average person of the same age.
Yes, that is correct. Parkinson's disease is definitely a risk factor for falling. Hopefully that patient would, start a regimen of medication that oftentimes helps normalize the movement to some extent. But rehabilitation for those individuals can go a long way as well. And so training and practicing walking differently is, focusing on increasing step length and step height can be done with those individuals. It might also be time to consider some sort of assisted device for walking, like a walker or a cane as well, that could compensate for some of the difficulties that the individual might be having with their balance. So yeah, fitness and rehabilitation can definitely help those people too.
I recall reading recently that the overwhelming majority of falls that occur, particularly those that result in serious injury or hospitalization, occur in people's homes. And within their homes, I am told, a lot of those falls occur in the bathroom. Is that correct? And if so, do you have some advice for individuals that might be at risk?
So bathrooms can be pretty hazardous places because a lot of times they are small spaces. And so if you are going to fall, you're potentially going to be, maybe striking the sink or the toilet or some other kind of fixture as you go down. And so they can be very hazardous places for that reason. There's also the risk of water being on the floor, or then you have a bath mat down and that might become a trip hazard. Or if somebody's dealing with incontinence and then hurrying to get to the bathroom in time, that could also be a potential risky situation. So in bathrooms, grab bars around the bathtub, the shower, the toilet can go a long way in terms of helping somebody have a point of contact that they can hang on to as they are getting on and off the toilet or in and out of the bathtub or in and out of the shower. Simple devices like shower seats or bath chairs can be used, so that way you aren't having to stand during bathing. That can help reduce fall risk as well. And then, being mindful at trying not to get water on the floor and then avoiding especially really thick bath mats that can become a tripping hazard would be some environmental changes that can be made in the bathroom to improve people's safety.
So no more of those thick, fluffy bath mats, huh? All need to go. I'm sorry to say. So, another question that I get asked a lot, particularly from older individuals, family members, etc., is there a good way to fall? In other words, should people think about if they're going to lose their balance, heaven forbid, even if it's on a slippery, icy surface or in the bathroom, etc. Certainly, landing on your head is probably not the best advice that you would want to give people. But are there instructions or practice that people should think about?
So usually the recommendation is, if you have time to think of it at all and react at all, would be to protect your head. As that's the number one thing. It's kind of human nature and normal reaction to like stick out your arm or something like that to kind of brace yourself and catch yourself from falling. But probably better to break a wrist than to end up striking your head and end up with a concussion or a brain bleed or something like that. So to the extent that you're able to, if you could try to tuck your head as you go down, that would be the advice in that situation.
Super. Well, we have another caller. We have Rusty from Texas calling us this evening. Rusty, thanks so much for joining us. And what is your question or comment tonight?
My grandmother fell a few months ago, and ever since it seems like she's kind of been scared to go for a walk or even move around the house very much. Do you have any suggestions or ideas on ways that, one, we can make the house safer for her, and two, maybe help restore some of her confidence in moving around both in and out of the house? And thank you so much.
Well, thank you for calling, Rusty, and I'm so sorry to hear about this. So, Dr. Venema, this really is a question of home safety and rebuilding confidence after somebody has taken a fall.
Yeah, so when it comes to home safety, there's a lot of changes that we can make in our homes to make our home environment safer. I mentioned the importance of vision earlier, and so having adequate lighting throughout the house, making sure that lights are turned on at night when somebody's going up to go to the bathroom, maybe night lights in hallways or bathrooms could be a change that could be made as well. Reducing clutter or trip hazards is something that's generally pretty easy to handle. So just making sure furniture is moved in a way where walking paths are clear and that things don't end up on the floor, a lot of clutter. I think back to my own grandmother growing up, and she had throw rugs everywhere in her house because she was adamant about protecting the carpet. Had I known then what I know now, I would have asked her to pick those up and not have those throw rugs everywhere. But again, removing tripping hazards is something that's really important. Rearranging maybe the kitchen, for example, putting dishes and small appliances and things that you use on a really frequent basis in drawers or on shelves that are easy to get to. And so that way you avoid from having to bend down all the way to the floor to get something or get up on a stool and reach something on a really high shelf. So putting the things you use the most frequently within easy reach is also something very simple that people can do. Some more permanent changes that can be made to the home would be including like installing grab bars in bathrooms, like I mentioned earlier. Railings on stairs are really important, and so having those in place as well are some simple changes that you can make in your home environment. When it comes to the fear issue, oh, go ahead.
No, I was just where I was going to go, the fear issue. Please go right ahead.
Okay. So with the fear issue, this is a real problem. Fear of falling is something that I haven't personally studied, but I've read some of the research about, and it's a definite real phenomenon. And so when older adults fall, even if it's not a serious fall, even if they don't get injured, sometimes they can develop a fear of falling and lose their confidence. And what that causes is kind of this downward spiral. If you're fearful of falling, you're going to start limiting your activities. Maybe you don't go out of your house as much, so your social world shrinks all of a sudden, and you're not as physically active anymore. And so then you start losing strength and balance and endurance. And so that can have some serious repercussions at increasing your fall risk over time. And so I like to do what I can to empower my older adult patients to to take ownership, like empower them to make those changes in their home, and that will improve their confidence. Get them going on an exercise program and see that they can make some gains and have some success with that. Another thing that I like to teach my patients how to do is how to get up from the floor. We call that a floor transfer, transferring from a position from the floor into a standing position, or at least from the floor to a chair. And sometimes just knowing that they're capable of doing that helps reduce the fear of falling as well. So empowering them to actually take action and do something about it can go a long way to reducing someone's fear of falling.
And do you have any advice as it relates to some of these electronic notification devices? I'm sure you've seen these things that people either wear around their wrist or hang like a pendant around their neck, or perhaps sit in their pocket, that in event something does go wrong and they're alone at home, or they're in the bathroom or upstairs, that they can get help. Is that something that you recommend to build confidence?
Yes, I mean, those can be very helpful, especially for people who live alone, because it gives them a point of contact that no matter where they are in the house, if they go down and they aren't necessarily by a telephone, they can use those things to call for help. And some of them are sophisticated enough that they can actually detect falls. So if there's a sudden acceleration that is sensed by those devices, it will trigger a response, and that can also help reduce fear of falling, just because it's a sense of having somebody kind of looking out for you, so to speak.
And finally, before we run out of time together, hospitals are also places where people do fall. We don't have a huge amount of time left, Dr. Venema, but I wonder if you'd comment on that, and particularly, what do patients and their families need to know to try to limit that risk?
Yeah, so when you're hospitalized, you're there for a reason. You're there because your health isn't necessarily very good at that moment in time. I mean, you're there for an acute medical illness, and that can oftentimes impact your ability to move safely. And so hospitals do a lot of work to keep their patients safe from falling. You might see a physical therapist while you're in the hospital. The nurses might have you always call to ask for help before you get up. People who are identified at high risk for falling in the hospital oftentimes have a special color bracelet or a special color of non-slip socks to help make sure the staff can readily identify those individuals at risk for falling. And so really the number one thing that patients and families in the hospital can do is to partner with and listen to the hospital staff, follow their instructions about whether or not you need to call for help, and steps that you can help them help you with while you're there, because a lot of patients, they don't appreciate how sick they maybe are. There might be somebody who was perfectly fine before, not necessarily at risk before the hospitalization, and then all of a sudden they have this acute medical event and everything has changed, but they don't necessarily appreciate it. They're also in a different environment, and you might have things like IVs or oxygen tubing or a catheter attached to you that then becomes a trip hazard. And so all of that kind of together increases people's fall risk. And so partnering with and following the advice and recommendations of the staff working with you in the hospital is really important.
Absolutely. And I know our institution has a huge program to prevent falls, and particularly in older adults who may become confused, etc. So we have just a minute or two left. Dr. Venema, do you have a parting bit of advice as it relates to fall prevention for our community?
Sure. What I would like people to know about falls is that they aren't necessarily a normal part of aging. And so I would hope that an older adult or a family member wouldn't be afraid of bringing up falls with their healthcare professional, because there's a lot that can be done to reduce falls. And the sooner that your healthcare professionals can help you take some steps to reduce your risk, the more likely you're going to be able to maintain your independence for a very long time. There's unfortunately a stigma about it, or people don't necessarily equate it with their health, or they think it's just a normal part of aging. but it doesn't have to be. So talk to your healthcare professional about falls if it's something that's concerning you, and answer their questions honestly as well if they happen to ask you about it, because it's starting to become a more common part of annual physicals for older adults. So be honest and accept the advice and help that they're trying to give you.
Yeah, and certainly for older adults and their families, you know, if you see something, say something. If you think your loved one is unsteady or needs some advice, that's a good thing to bring the attention of their healthcare professional, and perhaps some treatment, adjustment of medications, etc., could be very helpful. Well, I want to thank you for this amazing show tonight, Dr. Venema. Your advice for young and old alike has been just incredibly helpful, clear. I know there's a lot of material that's available on the web that people can go to, and that linkage is important. But it also seems to me that we need to destigmatize this concept of loss of balance, unsteadiness, shuffling, and falls, and use this as an opportunity for individuals and their family members to ask for help, to bring it to attention to others, so that these falls can be prevented and not result in hospitalization and serious injury. So thank you for this great advice, and thanks for joining us tonight on Royal Health Matters. Now, ladies and gentlemen, if you have a question or comment that you were not able to get to tonight, please leave us a recording. The best way to do that is to call us at 855-776-6147. Again, that's 855-776-6147. Or if you don't want to leave us a recording, please feel free to send us an email, as many of our questioners do, at newsdesk@rfdtv.com. Again, that's newsdesk@rfdtv.com. We appreciate your calls. We appreciate your emails. And we will see you again next Monday night at 6 p.m. Eastern, 5 p.m. Central. And remember always that rural health matters. Thanks, and have a great evening.